There's a lot happening with New Jersey's child welfare system. We want to help you make sense of it and share our story. This is DCF on the Air.
This is DCF on the Air, and I'm Jason Pikowski. Through this podcast series, we've been examining innovative and exciting new programs and practices being developed through New Jersey's child welfare system to better support children and families in our home state. And when we talk about the evolution of child welfare from protective, punitive, and reactionary to preventative, collaborative, and proactive, part of that transformation is the acknowledgement that system interventions don't always put food on the table, or in this case, a roof over our heads. Sometimes, in fact, most of the time, when a family comes to the attention of child welfare, it's not because of something the parents did to their children. Instead, they may have an unmet material need, and they just need a helping hand. In 2020, more than 480,000 children nationally came to the attention of child welfare systems as a result of an allegation of neglect. That accounts for 2/3 of all cases reported to child welfare systems throughout the country. And in child welfare circles, neglect has long been synonymous and interchangeable with poverty. The system's response for too long and for far too many families has been, you can't care for your kids, so we're going to remove them and place them with someone who can. So poor families are punished for the cardinal sin of being poor. And when we separate families because of neglect, and again, I want to differentiate, this is neglect stemming from poverty, not some willful choice to withhold what a child needs to be safe, healthy, and connected. But what that system has done is impart trauma on that family and on the child being removed. In our rush to, quote unquote, save the child, we lose sight of the fact that keeping families together is so much better for the child's well-being and the family's long-term stability than pulling them apart. In New Jersey, instead of jumping to separation as a safety intervention, and as a point of pride here, we have the lowest family separation rate in the entire nation. We're taking the time to understand families' needs and connect them to other avenues for help. In 2014, we launched a supportive housing pilot, Keeping Families Together, and to date, we've helped nearly 1,000 families in New Jersey maintain safe housing, access wraparound services, and avoid deeper involvement in the child welfare system. In 2021, we took this a step further and created an Office of Housing within the Division of Family and Community Partnerships to organize and oversee housing programs for youth and families, including the Keeping Families Together program, or KFT. Joining me today is KerryAnne Henry, Assistant Director overseeing the Office of Housing. I'll turn it over to KerryAnne to introduce herself and talk a little bit about her work. KerryAnne?
Hey, Jason.
Hey, how are you?
Good. Thanks for having me on.
Absolutely.
My name is KerryAnne Henry. I'm the Assistant Director for DCF's Office of Housing. And I've been in that role for the last 2 years since we established the office. But I've been in the housing and human service space for quite a while before that. I've been with DCF for almost 2 decades. And that experience ranges from child protection to program development and more recently, housing and similar programs. And so looking forward to our conversation today.
Well, we're so happy to have you. And thank you for that introduction into your work.
Thanks.
So I'd like to start off asking a question, and I hope you don't find this dismissive to the work that you're doing, but I'm wondering why housing? We know from our work there's a variety of material needs that families have. It could be food insecurity, unemployment, access to healthcare. I'm wondering why we created an Office of Housing at DCF and why we focused on housing and shelter as the need that we were going to address through your work.
Yeah, not dismissive at all. And I think you're right. There are a lot of competing priorities, right, that families have to manage. But housing is foundational to all those needs, right? We know that housing impacts every single life domain, whether it's education achievement, health, life expectancy, earning potential. All of those things are influenced by housing. And so in many ways, as a community partner who serve families and children, and we're really looking to impact safety and health and connection, I would ask, how can we not be in the housing space, right? I also think we've been in the housing space for a very long time informally, right? And so what that looks like is paying rents or paying security deposits, buying furniture. And so we were in the space in an unintentional way before. I think this office now brings it to the forefront and really allows us to be part of the state's response to housing needs and preventing homelessness. And that is crucial to strengthening families for sure.
Absolutely. And I think I appreciate that point that, we were kind of already working in this housing space, helping families connect to safe housing through helping pay rent or any of those informal supports.
Right.
But before we got to the Office of Housing, we already had a formal component to our housing programs through the Keeping Families Together program, which of course you oversaw, prior to coming to the Office of Housing role. I'm wondering if you can talk about, I think KFT is coming up on its 10-year anniversary next year. Right?
Yeah.
So what's the response from the public? And in particular, I think folks that are working in the housing space, that DCF has been involved with housing for as long as it has been in sort of a formal way through KFT.
Yeah. I think when many people in the housing space think about DCF, they think about youth, right? Youth and children that we serve. And so they may be surprised to know it's 10 years in the formal family supportive housing space. But I think what we also hear from parents across the state, whenever we talk about KFT, there's always this excitement about the project. We love it. We wish there were more slots. And so I think there is this mix of who knows and who doesn't know. But I think in some ways, I'm sometimes surprised that it's been 10 years. Time flies. But that 10 years really speaks to the commitment of not only DCF, but many statewide partners in really supporting vulnerable families. It's no easy feat to create and sustain an intervention the size and scale of KFT. And so whether it's our partners at DCA, DHS, local landlords, community partners, it has really been a commitment from many, many collaborations to make this 10-year journey possible. And so we're really grateful for all of those stakeholders, and especially families who've really trusted us to work alongside them in this way.
And nearly 1,000 families in 10 years' time. I think that's such an impressive stat.
Really
I want to focus on the KFT model for a second.
Sure.
What does that look like for the families that are connected through KFT? What kind of supports might they be able to access through supportive housing?
Sure. So KFT is a model of family supportive housing. It's a national model, so you'll see it right in other places, of course. Here in New Jersey, what it looks like is access to affordable housing paired with support services. And support services is a very broad umbrella. And there's well, what does that look like? On a day-to-day, it's really whatever it takes to get that family into housing, sustain that housing, and then help them move on from an intervention like KFT. So it means finding an apartment, means paying a security deposit, buying furniture, talking to landlords once you're in that unit, because inevitably things are going to come up as they do in any landlord-tenant relationship, helping families navigate those relationships to sustain housing. And then when they're ready to move on, helping them do that. So transitioning them from the project. And I think the other component that often gets missed, but really should be included, is when families move on, they can tap back into services. So if there's a need down the road for a resource or a quick check-in, they can absolutely do that, and often do with their provider partners.
The KFT program and many of our housing programs offered through DCF, and thinking about youth transitional housing as well.
Sure.
They really rely on our partnership with the Department of Community Affairs.
Right.
I'm wondering if you can speak to how important that partnership is in our efforts to support families through their housing needs.
Yeah. So our partnership with DCA is crucial. And I'll add a bit of context here. DCA administers over 30,000 vouchers across the state. And I include that because I think it's so important to note, as the state public housing authority, the volume and scope of their work. Without them, this work isn't possible. Because the other piece of that is DCF as an organization, we don't administer vouchers at all, right? We don't buy units and subsidize units. And so it is a critical partnership. And they have really been not just flexible and committed, but really just deeply rooted in this work and have really come alongside us for over 10 years to administer not just family housing, but also our youth housing programs as well. And so I really do think it's a model for the ways that system partners can work together to administer not just projects, but really be able to impact society level outcomes for youth and families.
Yeah, I think it's really about connecting the different people, having the right people in the room who have access to the right supports to really improve families' outcomes. And I think that's really kind of typified by what you're doing through the Office of Housing.
Absolutely.
So you referenced it a little bit in your response about youth transitional housing. And I kind of want to move to that space a little bit and talk about some of the programs that you currently support that are more like youth facing and youth focused.
Yeah.
What kind of supports are available for youth that are either maybe they're older in the system or they're at that point that they're transitioning out of the system because they're aging out from the system?
So we support young people in a number of ways. I'll include a bit of context here as well, just for scale. DCF supports about 1,800 young adults between 18 and 21 on a monthly basis, right? And so a subset of those young people do require some housing support. And so our housing continuum for young people really fall into three buckets. The first is transitional living, and that means it's a space for young people to test out living on their own, but there is some supervision there to help them with that transition. The other bucket is supportive housing. So similar to KFT, it's a more independent living space where that young person has their own lease and they're able to really be independent and manage that household on their own. And then the third bucket of work we implement is street outreach. And really what that's designed to do is help young people connect to resources in the community. So that includes a provider going out and really canvassing communities and seeing where they can meet those concrete housing needs for young people. And so all told, we support about 300 young people in that housing continuum.
I want to focus for a second. You mentioned connecting to supports within the community. And I think that's been sort of a key component of the work that's happening right now within the Office of Housing is to develop those community relationships. Can you talk a little bit about how you're going about developing those relationships and who are your partners within the community to really help move along the agenda of the Office of Housing?
Sure. So the nice thing about New Jersey is that the housing space is so close-knit, right, which is great. And so that's the broader context that the office is coming in. And I'll say, though it's a new office, we've had some of these relationships in an ongoing way before the establishment of the office itself, right? And so we've continued some of those relationships as well. There's some new work happening, especially with continuums of care, for example, that lead the homelessness response in communities. So we're working with partners in Essex County, Middlesex, Jersey City, to really help target and understand what the needs are, but also increase access to housing in those spaces. Some other partners that we're working with more deeply for the first time include public housing authorities. And so there's almost 100 PHAs across the state, right? So we're not working with all, but certainly in select communities, we're partnering with PHAs, for example, in Elizabeth, in Camden City, as well as in Newark City, where we're piloting a youth housing initiative alongside the PHA in those areas. And so those are two main partners that we've really deepened the work with. But I will say, the housing landscape includes all these other stakeholders, right? Whether that's Monarch Housing, they administer the point-in-time count. We work really closely with them around organizing COCs and how we work best with them. LSNJ, we work with them on legal issues that often come up in families and having them support the work as well. So I think there are a number of partnerships that we are exploring and have been exploring for the last 2 years as well.
You mentioned how tight-knit the housing or housing advocates, the in-community providers, how tight-knit that community is. I'm wondering if you've had any difficulty kind of connecting it because maybe they're not really sure about what DCF's role is in this space.
That's a great question, Jason. What I'll say is different communities have different priorities, right? And so what we try to do is align our priorities because we also understand resource is a very real factor in partnership. So making time for conversations and planning and things like data matching, all those things take time and resource. And so sometimes partnerships, the will is there, but we have to make sure the resource capacity is there too. And so I think that's a consideration that comes up in which stakeholders we partner with first. I think the other consideration is where do we see the most needs, and allowing that to also drive how we prioritize stakeholder relationships. As we look at the data, we can tell now more clearly where do we see the highest volume, right, of need for young people, for example. So Camden and Essex stand out as the top volume counties, but that's not the only consideration when we think through stakeholders, but it's one.
And I know that you're also very much connected to our colleagues in other states that are working in this space. I'm wondering how unique New Jersey's approach to connecting to housing supports for our families, for our youth. How unique is that, or are other states kind of working in this space as well, kind of in a similar fashion?
Yeah, so New Jersey is one of the first places to have an Office of Housing within their child welfare system. And so I'll start by saying that. We're really proud to be doing that work. That being said, I think every state has its own network of resources, ways of relating, right? And so it looks different. I will say in a more formal space, New Jersey is the first to do one of the first to do that work in terms of the child welfare space. Connecticut is one of our really close partners, and they've done a phenomenal job around family housing for decades. And so we partner with them on what they've learned along the way as a system that's been doing this for much longer. And so they're one of the first that come to mind when I think about states that we lean on in terms of learning. But we lean on other places too, like San Fran. We've worked with them on a number of projects. Because they have such a tight housing market and have always had that. We've leaned on them in the past for learnings. And so it really depends on what the need is and where the gap is. We'll partner in different ways.
Great. So my last question for you.
Sure.
What do you see next for the Office of Housing? And how do you see that connecting specifically to the future of child welfare in New Jersey?
Sure. So as a new office, it feels like the opportunities are boundless, right? But there are a few places that we're looking to impact in the future. I'll highlight maybe three of those. Data capacity and building that capacity for integration with other systems is important. It helps us to understand better what are the housing needs of families. Families, for example, are unique in that they're often doubled up. And so they tend to get missed in formal housing counts, right? And so how do we bring that to the forefront in a better way so we can get access to those resources for families that need housing but might be precariously housed and not formally counted? And so we're working on data integration with certain partners to get at not just need, but also resource allocation. How do we allocate resources based on what we see in the data? So that's one area. The other that we're working on is capacity building with our child welfare teams. So our child welfare team across the state includes about 4,000 social workers that support youth and families. And what we see more and more with the housing crisis being as it is, social workers are spending much more time and resources to meet the housing needs of families. And so how do we best give them the tools they need to do that job well? And while also connecting families to the right resources, right? And so we are in the planning phases of that work right now and really trying to pilot ways that we can build capacity with our child welfare teams. Some of that work is underway already. We currently facilitate a statewide call on a bi-monthly basis with the intention of increasing awareness of housing resources with our child welfare folks, right? And broader community stakeholders as well. And then the third area that I'll highlight in terms of future thinking is really around expanding access, right, to evidence-based interventions in addition to affordable housing. And what that means is we are in the process right now of piloting My First Place, which is a transitional living program that is evidence-based, designed for young people 18 to 21. But really, it's our first time in the space of evidence-informed, evidence-based intervention for young people that focuses in on education and employment, with housing being somewhat secondary. And so we're really excited to bring that into the fold as part of the continuum. And those are some of the things we're looking forward to.
Oh, that all sounds really great. And I want to thank you for taking some time to talk to us today about some of the great things that are going on. When you think about that famous line from The Wizard of Oz, "There's no place like home," building that sense of stable place for people to feel safe, feel secure, and ultimately to do the things that they need to do to thrive as a family. I think that your work is so important to that. So thank you so much.
Jason, thanks for having me.
I know you have some upcoming opportunities in which you're going to be connecting with people within the housing realm to promote the work happening here at DCF and hopefully make some new and crucial partnerships to advance our work to support families. But I also want to plug an upcoming opportunity to have a deeper conversation about the evolution in thought in child welfare. On October 19th, we're teaming with the New Jersey Task Force on Child Abuse and Neglect to host a conference on the intersection of race, poverty, and neglect in child welfare. This is an opportunity to rethink how our system treats families with unmet material needs, many of which we talked about before, and to look for better alternatives than system involvement. If you plan on attending that conference, please stop by and say hi. We'd love to hear from you about some of the topics that you'd like to see us explore on this podcast, and also how you're sharing this podcast to advance your own practice. Really, this conversation about the transformation of child welfare, it works because we're working with all of you. You're the ones that are making this transformation possible. So thank you for that. And on behalf of my producers in the Office of Communications and Public Affairs, this is Jason Pikowski signing off. Tune in next time for more DCF on the Air.